So
we're going to start out this morning talking to Dr. Danny Lai with Chiropuncture in Oxnard. And Danny's been on the show before. And, I'll disclose he's our chiropractor and acupuncturist and Chinese herbalist. And welcome to the show, Danny.
Good morning, Jeff. Rosandra.
good morning. Wow, that's a lot of pressure, don't you think? You wear 3 hats in our household.
I wear a few more.
Well, welcome to the show. I wanted to bring you back because the other thing that we've been really working on the last couple of weeks is workers' compensation. And work comp is something that everyone seems to be frustrated with in terms of how the process goes. And so I just wanted to briefly go over how the process goes and then kind of let you tell us where you see yourself and you have been able to help people. So just so all of you know, the way that work comp gets enacted is an employee claims that they were injured on the job. And whether it's true or not, or someone's seen them, it doesn't matter. You do need to give them the DWC-1 form so that they could tell you what happened and use that information to file a claim with your insurance company. Now, when you're opening up a claim, one of the things that the claim person or whoever's taking the information will ask you is, has this person sought medical attention or not? And the reason is it's expected that if there's, for example, blood, like they cut themselves, they're not going to wait 24 to 48 hours before an adjuster is assigned to go seek medical attention. It's expected that they go to urgent care or seek medical attention to stop the bleeding, for example. But there are other things that sometimes an employee will need to see medical attention before the adjuster is assigned. And sometimes that could mean that they, when they were first hired, assigned not a traditional Western medicine doctor, but assigned their chiropractor or acupuncturist as their work comp doctor. In that event, someone like Danny would come in and they would be the ones that they would be able to go see. So that was a long way of saying, yes, chiropractors and acupuncturists can in fact be a part of the work comp process, right?
Yes.
Okay, so what types of injuries have you seen under work comp?
Well, the most common one is neck and back pain, some hand and shoulder injuries.
Okay, do you consider these to be regular injuries or challenging injuries?
Most of them are regular per se. The challenging are the one with the neck and back disc issues that are confirmed with MRI findings or positive findings as far as the disc herniation.
Okay. So when somebody comes to you because they've designated you their work comp doctor, what can they expect?
A hard road.
Why is that a hard road?
Well, it typically is difficult to work with the insurance carrier, especially when it comes to chiropractic and acupuncture. And even if there's approval could be 6 visits. What much work can be done? A little. But if they have a disc problem, they're going to need more than 6. So it's a lot of proving on. Well, you got to do a lot of proving, I guess, but they are actually more inclined to approve a MRI study versus a $25, $50 chiropractic acupuncture procedure. Mm-hmm. They're going to compensate, where an MRI study would be $3,000. Mm-hmm. So that's one of my beef, I guess.
Right, because I think that, and we've talked about this in past visits, that people still don't quite understand the benefit of chiropractic and acupuncture as a medicine, because they don't really understand the benefit of it is not just short-term, but long-term. They kind of just do it a little bit. They think 6, for example, is a lot, but 6 in reality, is that really a lot?
Well, people exercise 3 times a week, 52 weeks. What's that, over 150 times a year? They're not complaining. But I asked them to come to see me 6 times. Oh my God, that's a lot. How many times you brush your teeth a week?
Well, to be honest, a lot of people don't exercise.
Well, that's honesty. Yeah.
But yes, I mean that's you're true. It's all a matter of perspective. It's how often, how much do you think it really needs for your body to heal? Because one of the things that I specifically love about walking into your office, or rather your practice, is the fact that you have quotes throughout the entire practice that reminds people that the body can heal itself, but it needs the proper care. Can you talk a little bit more about that?
Well, let me address about what you said earlier about, acceptability as far as chiropractic and acupuncture versus medicine per se. There is a disconnect in people's mind because chiropractic and acupuncture is based on the law of the human body. So if they question chiropractic and question acupuncture, they really question their belief system because medicine is made by man, right? And with chiropractic acupuncture, all we're doing is working with the law of the body. So all we're trying to do is restore function. And if the person is not responding, it's not because chiropractic acupuncture didn't work. It means their body didn't work.
Ooh.
That's kind of frightening.
Well, yes, but I mean that's also why I think that he has multiple ways of getting the body to work. I'll use myself for example. My neck seems to be something that is continually an issue. And yes, I know exactly which vertebrae is going to be the issue because as Dr. Danny has said to me, I need to let things go. I don't think he realizes I'm in HR. I don't let go of anything.
I don't think HR has anything to do with that.
Proceed, yes, okay. But then I also realized that I was having all these other things, and he says, okay, well, what's really going on with your body? And so it's not so much one thing, it's a matter of, I mean, I've been told by several doctors I'm 50, so it's going to be downhill from here. And I've determined, and I am determined, that that's not true. It's a matter of how do I maintain what I have without it just going downhill from here. But in order to do that, I have to be open to the possibility that maybe it's a combination of things. I don't just need chiropractic. Maybe I need some acupuncture. Maybe I need some Chinese medicine. And you need someone that has the knowledge to actually be versed in all three of those things. Not just, I mean, we went on a cruise and they were giving away acupuncture.
I was on a cruise recently, yes, I saw that.
Right? I'm like, how do you give away acupuncture? But of course, I had to go see, and they're like, well, just lay down. And I'm like, whoa, wait a minute. I'm not giving you permission to do anything. I just want to know what, this whole giving away thing is. But I think it's like that. It's a gimmick. A lot of people have made it a gimmick when in reality it's medicine, and it should be medicine. So going back to that, you have challenging injuries. So what types of injuries have the best results with chiropractic?
Chiropractic mainly is the spine-related issues. So it could be the neck, the mid-back, the low back. As long as they don't have a disc issue, majority of them respond really well. Even if they actually have some disc issue, they respond to chiropractic adjustment if provided with a specific adjustment. Not your generic shotgun approach. Lay on your side, give you a motorcycle kick. Lay on your other side, give you a motorcycle kick. That could be a bad thing because you just can't services.
I was just thinking, I don't think I've ever been on my side in your practice.
I don't do that because I don't want to be that done to me either. Per exception, if a chiropractor is laying on my side and adjusting specifically L5, for example, and put their palm right on L5 and move that vertebrae, yes, go for it. But if they're just putting their hand just randomly, I won't say randomly, but on your back, and they just give you a motorcycle kick, that's just pure laziness.
Ooh, but again, it's a matter of, how you approach your practice. You have a deeper knowledge of it, so you approach it differently.
Well, here's the thing. When chiropractor went to chiropractic school, we were told by our teachers, doctors, find that vertebrae and fix that vertebrae. But somehow along the journey, the majority of my peers, as far as chiropractor, got lazy. And all they said, just lay on your side, I'll give you a motorcycle kick. Lay on your side, I'll give you another motorcycle kick. And the general public would know. So that's more like a shotgun approach. But in fact, what chiropractors should be doing, what I'm striving to do, is be specific. Palpating for the specific joint, adjusting the joint, sniper mode. And that's how you get results. Because if you're doing generic one, people are going to feel sore because you're moving things when you don't need to move. That's where people get injured and feel worse and gives chiropractic a bad name. Now, let me tell you this. My chiropractor, I asked him, hey, what is the percentage of our peers are doing generic chiropractic versus what we're trying to do, being specific? Shocking answer. 90% are doing generic adjustment, according to him. I was thinking more like 60, 70, but I think maybe he's right.
I think so, and it's just because you're very right. The general public doesn't know what to expect, and when you don't know what to expect and somebody says, you should try my chiropractor, it's almost like when there's a fear of, I don't want to hear my bones crushing, you're going to tear my head off, all these things that generally people think about. And then they don't know that what they're walking into is not probably what the doctor was taught or what is being expected. So it's nice to hear sniper mode. I like that term.
Yeah, I mean, Danny's pretty focused when you go in for an adjustment. I mean, he doesn't just do an adjustment. He does take a time to feel your spine, and I don't know what he feels, but he feels and just targets certain areas of your body to make the adjustment to.
Right, which is also why I want to say we're never sore.
No.
And that's the other thing that people kind of go, I don't want to go to my chiropractor because I'm going to be sore, especially after an accident. When somebody's fallen, they're already in pain. They don't want to be in further pain. So this is good to know that it needs to be very specific.
Well, I mean, that one time when I threw my back out, I went in to see Danny in pain, and I walked out not in pain, so.
Right.
You just talked about accident, right?
Yes.
Being a chiropuncturist gives me a huge advantage because sometimes they're so hot, meaning they're so in much pain, can't touch them. We just do some needle magic called acupuncture.
Needle magic. So let's talk about that, because a lot of times when people go to chiropractors, you're absolutely right. It's so inflamed that they really shouldn't be touched at that point. Yeah. But the needle magic helps the inflammation come down. And that's just based on how many years of medicine?
Oh, only 4,000 years.
4,000 years.
That's all.
That's all.
Modern medicine, so-called modern, is only conceptualized in 1939 by the discovery of penicillin. So who's the real quack?
I like that. Who's the real quack? So when somebody designates you as their work comp chiropractor, and generally speaking, they don't really tell you because they don't have to get your authorization. They just designate you. Do you find that people even know that they can do that?
Most people don't.
Yes. A lot of people don't know that that's actually one of the forms that should be in your new hire paperwork. There should be a work comp doctor designation or a chiropractor or acupuncturist designation. The difference here, and this is the reason I said it like that, is for the doctor, you're expected to take that note to your doctor for signature, which means they accept being your work comp doctor. But for chiropractor and acupuncturists, they don't expect that same acceptance. So I'm going to say that a lot of people actually do have their designated work comp doctor to be a chiropractor or acupuncturist. And that's going to be more common than we actually think. More and more people are going that route instead of the doctor. Why? I think one of the new hires we had this week kind of said it in really general terms. They said nowadays your medical doctor doesn't really want to see you unless something's falling off. And I thought, ooh. But when you think about it, most of your doctors like the telemedicine. They say go over the phone or the video and things of that nature. Could you do chiropractic like that?
No, and I don't want to do that.
Right. Well, you need to.
There's a saying I like to say, if you come see me and you didn't see me, you didn't see me.
Nice. That's exactly it. And the other thing that I wanted to...
And I'm also good, too, in terms of AI. I don't think AI is going to replace me soon, so I'm okay.
You're okay. Well, the other thing I was going to say is you also don't rush through your sessions with people. So it's not like you're rushing through people, so get out of my office. It's more like you take your time to really not only adjust them, but then to hear what's been going on between adjustments so that you could verify what it is that they're going through. And I really appreciate that.
When I work on people, I'm hyper-focused in what they need, but then I wait for them to tell me what they want, and I'll do accordingly. But if it's just the back and neck, as far as chiropractically, I don't really need to ask the person, although they want to say, which I will let them say, right? But if it's their need and they need to tell me need, then I'll address the need. But most of the time, I just do my work, and the fingers knows where things needs to be done.
The fingers know. Well, just so that people know, you're not a beginner chiropractor.
Well, licensed for 30 years plus 3 more years of chiro school, so over 30 years.
And that I thought that was very important for people to know. Not that they shouldn't trust their chiropractor, but they need to know that you're talking from experience and your knowledge, and it's not something that just happened within the last couple of years. You kind of been around the block a bit.
Well, as far as being around the block, I can tell you these days my exam is actually the history. My questioning of the person, when I ask people, they're intentionally going down this diagram. And when I go down this diagram, I know exactly what I need to do. And a lot of time, the exam is not even necessary because I already know what I need to do. If they say, hey, it hurts when I walk, my back hurts when I walk, I already know what I need to do. And I'll just point to the person to let them know that I know, that they know that I know.
Yeah. So tell us, how do people get in touch with you, Dr. Danny?
My website, drdannylai.com, LAI.com, 237 West 7th Street, 805-240-2640.
Awesome. Thanks for coming in, Danny. Can't wait for our appointment this week.
Thank you.
Fun with HR is brought to you by the HR firm. You can reach us at 805-853-3476. If you have employees, you have issues.
No land digger today, right? I just eliminated it.
Yeah.